Unfortunately, my business partner had a sudden death, and that changed my whole world. One fine day, it all shatters, and then you have to rebuild everything. Because you always feel like you're never enough, you're not doing enough, or you're not worthy of things that comes your way.
So what's your most outrageous, unexpected moment?
He's in his bathroom, and it goes all the way down, and I was like, oh my God, I don't want to see this.
Welcome to The Patient is Always Right. Today we have Dr Nisha Menon from Nish Clinic talking about how she started her career in Moscow before moving to the UK and working in the NHS, and how content is so important and why it's important to put yourself out there, as content is the consultation before the consultation. So let's dive in. Hi, Dr Nisha. Thank you for coming on The Patient is Always Right. It's lovely to have you on.
Thank you for having me. It's a pleasure.
Yeah, it's exciting. So we're going to start with a little warm-up round just to ease you into all the questions that I'm going to be asking you. So if you answer with your first instinct, and yeah, we'll get going. So first one, subtle tweaks or bold transformations?
Subtle tweaks.
Nice. Speaking on stage or performing treatments?
Treatments every day.
Love. Science or artistry?
Oh. It's a combination of both, but I think science first.
Mm-hmm. And scaling a clinic or staying boutique?
Staying boutique.
Love that. That particular question, I was like, we're going to dive into that one, and I'm going to ask you lots of things around that, because that's a really interesting answer, and everyone always answers it so differently. So just for everyone who doesn't know you yet, tell us a little bit about who you are and your background.
So my name is Dr Nisha Menon, and I've been a medical doctor for over 23 years now, and aesthetics for the last 12 years. In between, I've had dive into various businesses. And yeah, here I am.
Here you are. So obviously you said that you've been in medical background for a long time. So tell us about how you chose medical background, how you got into that, and eventually how you got into aesthetics.
So medical background, the driving force was my mum. So my parents separated when we were really young, and she's a retired nurse now.
Okay.
And at that time, because she had a job, she could actually bring us up. So from that point, I had it in my mind that I want something, a kind of profession where I can be by myself, provide service. So that's when I thought I'll become a doctor.
Amazing. Oh, I love that your mum was your inspiration. That's really sweet. And was aesthetics always on your radar, or did that come a bit later?
It came much later. I never thought I'll be doing aesthetics. So this came about almost within my working role. I work as a stroke physician, and we treat patients with muscle spasticity with botulinum toxin. So we were, on a training for this, treating patients. And when the training finished, the rep at that time approached us and said, "Oh, we're running a course for facial aesthetics, and we'd like you to join." And it was a free training. So me and my colleagues were like, "Oh yeah, why not?" Like, we didn't know anything about facial aesthetics at that time. This was like 12, 13 years ago. And then we decided to go on the course, and we never looked back.
I love that. It makes so much sense, actually. It's such a, obviously complementary to what you do. So of course, naturally, you'd kind of learn more about it, and then also technologies change all the time, right? Because you're very much into technology, which we'll obviously talk about, which I find really interesting, because it's funny, a lot of people go one way or the other. They stay very much within sort of, injectables, and then you've got the ones that are more sort of device based, but you kind of got both.
Yeah, both, mix of both.
Yeah, nice. Was that off the back of your client base, or was it more like a personal preference to have both?
More personal preference. I never wanted to be called as a Botox doctor. Since the time I started, I was quite clear, because in those days people used to call you Botox doctor.
Yeah.
And for me, that I didn't like the term, and I wanted to do something different. So that's always been, from the beginning, I wanted to be different and not offering the same service what everybody does.
Yeah, absolutely. So you trained internationally before building your career here, obviously in the UK. How has that shaped the way that you practice?
Very much, everything. So I went to Moscow when I was 16 to do my medical degree. This was a time, oh God, I feel like a dinosaur now. So this was a time when there was no mobile phones, no internet. So 28 years ago. That I'm giving away my age, am I?
Well, you look fantastic.
So I went there when I was 16. Didn't know the language, didn't speak Russian. There was no internet, no WhatsApping, telling where I am or whether I got the flight or whether I landed. So I got to speak to my mom only after 3 days to tell her that I've reached.
Wow.
So for that, we had to go to the local big post office to make an international call. So those were the days. So that actually gave me a lot of experience being on my own, being in a new country without any friends, family or anything. And it taught me a lot in life. So yeah, I've carried all of that.
Yeah, absolutely. That's such a bold thing to do at such a young age. Obviously shapes you as a person, I'm sure.
Things are different now because you have constant, internet, you can Google things, you can find things out, but those days it wasn't.
Yeah, it's almost like when you're away, you're almost at home because you've got everything right there. Yeah, it's so true. So going forward a little bit, or bringing everything forward a little bit, what drew you to medical aesthetics?
So when I went for the training, and then initially, as everybody does, we all do it for like a bit of extra pocket money, right? So we started doing that. And then gradually I started to see how it's impacting the patients. So they were feeling more better in themselves, wanting more treatments, or, you can see the change in the patient. Their confidence has increased and they feel a bit more lively. And that's when I thought like maybe, I could do a bit more of this and make some more changes to the patient. So that's how I started to navigate a bit more into this field.
That's really interesting. So it's almost like seeing your patients sort of evolve emotionally, not necessarily just physically.
Yes, absolutely.
Amazing. Yeah. Love that. So what's one sort of cliche or misconception about the industry that you would love to debunk?
Ooh, one or two.
You can go for two if you like.
So for my colleagues, I've got two, not including dentists because they already have a practice. So this is like an add-on service to them. So it doesn't kind of apply to them. But for others like doctors and nurses, they all think that just doing a weekend course is going to get them a line of patients outside just because you're a medical professional, or just because you're a consultant, or just because you're a nurse or an ITU nurse or consultant nurse. But that's not the case. A certification is just a transaction of money. You pay your fees, you get a certificate. Like I can go and pay a fees to do a social media training. That doesn't make me a social media person, or I'm not going to earn 5,000-10,000 pounds from next month or drive a McLaren after 3 months. That would have been nice. So they don't understand that this course, which is either 1,500 or 2,000 pounds for a weekend introductory foundation course, you can't expect that the small investment, that is the smallest startup investment you're putting into a business, can generate 4,000 pounds in 2 months. How much is that? That's almost 150 or 200% more revenue, right? Which business is going to give you that? None. So they have this mindset that, I can make a lot of money just by doing a weekend course. And they don't plan their business. They just think about, okay, course, money, right? They don't think that this is a business I'm entering into. I need to have a business plan. Where am I going to practice? Am I going to get many patients? How much time can I dedicate to this business from my full-time job? Nothing.
Yeah.
And I've had so many colleagues who come to me now that my practice is established. They come for advice, like, what do we do? And some of them, they go and do the foundation course. The next day, they're signing up for the level 7, which is 7,000-8,000 pounds. And then they don't pursue this career.
Yeah.
So they don't think it as a business investment. They just think it's, okay, I can make some extra money. No, you can't. You have to think of it as a business.
Absolutely. I think that's honestly the one that I hear quite a lot and it surprises me because of course it's a business, but also just dealing with people and building a business that relies on customers is really hard.
Yes, it is. You need to have a passion for what you're doing. Yeah. So yes, it is a business, but you also need, you're a medical professional.
Yep.
So how you care for the patient, patient safety and everything. But if you don't have that business acumen, you can never run this effectively, fully as you want. So you need to have a balance of both. So, most of the medical professionals are not entrepreneurs or, business oriented. And that's when they kind of fail. Some of them, they sail through, they make it work. That's different. And obviously they struggle a lot throughout the course of their, career.
Yeah. I mean, running a business, whether it's an aesthetic business or whatever it might be, is hard.
It's hard. Any business is hard.
Yeah, it's hard. Yeah. Managing people, very hard. No, that was a really good one. Thank you. So Did you always plan to launch your own clinic, or was it a natural evolution to have your own clinic?
No, I didn't. It just happened naturally. So when I trained in 2012, as I said, those were the days when there was no social media for business. There was no WhatsApp for business. There was not much Instagram. There was nothing much of the digital platform that we have today. And nobody really had website because we were really small. Unless you were a big clinic, there was no way to advertise yourself. It was only leaflet drops. And when I finished my foundation course and wanted to set up, then I was doing mobile service. So I had to carry my couch and my treatment box and everything, going to patients' home. Going for free consultation was free because I had to drive and go there, going in a second time for the treatment, then again going in for a review. So then doing that, it got a bit too much because I was still a full-time NHS doctor, I have a young family, and it just became too much, traveling so much and going to strange people's house. You don't know them. Then I took a short break to finish my exams and stuff. Later on, I hired a small room in a salon. So that's how I kind of build up slowly. And then I had some setbacks after that, then took a short break again, and then again went into a friend's salon. And then pandemic happened in between. Everything was shut. And during that time, then I found a place closer to home because the other salon was almost 30 minutes drive.
Right.
So it was, again, I wanted something closer. And then this came up, and I did it all during the pandemic when we were in lockdown, took all the risk.
Wow.
And reopened it post-pandemic. So it just happened, everything step by step.
Yeah, didn't look back. It's funny, the pandemic is really defining for a lot of people in two ways. It can either be one way, like, you close a business because of that, but a lot of people I know started a business or started an iteration of their business during the pandemic. Do you think that's because it's almost like reflection on what's been going on in the world? It's like, I might as well take that risk and just go for it.
Yeah, I've always been a risk taker with anything, and I make impulse decisions. So for me, life's too short. So you have to do what you want to do when you want to do it. There's no point in doing it after 10 years because the time is gone.
So what's been the most pivotal sort of moment in your career that changed how you work? I know it's a big one.
There's been a lot of, things that's happened in my life over the years, from the time I went to Moscow, from the time I came to UK in 2003, worked part-time until I got my registrations, went into business with a business partner and put in all my energy and everything. My whole life, actually, 7 years, I invested in that business. We grew tremendously during that time. And unfortunately, my business partner had a sudden death. And that changed my whole world because financially, because that was my, source of living, source of income. And that one thing that it taught me is never go into partnership.
Go fully solo.
Yeah. So.
Wow.
And all the experience I got throughout that period was extremely valuable. So every business I've done, I've always had a business, wanted to do business from childhood, because when I was a kid, I used to, well, not kid actually, when I was a teenager, I used to sell the cassettes to my friends, and it wasn't too much money, but whatever it was then, maybe 50 pence extra. And when I was a student in Moscow, I used to put up fruit stalls during Christmas to make that extra money, and a few other bits and pieces. I always was interested in doing this side hustle kind of a thing, although being a doctor was a different need for me, but at the background I did have this thing that I want to do something. So all of these experiences kind of lead you in a way where you don't really know at that time that you're learning all of these things. Only when you kind of reflect after many years, like, oh yeah, I was doing this. I never thought whatever I was doing would help me to become the person I am today.
Yeah. Absolutely.
So,
I mean, sounds like real defining moments. So the business that you had before, was that different, obviously, to aesthetics?
yeah,
or?
it was different. It was healthcare. It was care homes.
Okay.
We're managing 4 care homes with almost 200 staff.
Wow.
Yeah, and multi-million turnover. So it was
Yeah.
a big business, very involved. And as any business, it is stressful, but equally you grow it as if it's your own.
Yeah.
And then one fine day, it all shatters, and then you have to rebuild everything. So another thing I learned from that is you always should have multiple sources of income, right? It doesn't have to be too much, but at least that will,
Yeah.
take over for at least a couple of months. So that is something I learned over time, that don't rely on one. And even the
really
pandemic
good.
has taught us that. So don't rely on one income.
Yes.
Anything can happen anytime. So at least you can fall back to something,
Yeah, it's so true, actually. That's a good point. It really did, the pandemic really did kind of open everyone's eyes to the side hustle, if you like.
Yes.
But more than that, just having your own sense of stability.
Yes, absolutely.
Absolutely. That's so interesting. So you are also a speaker and a KOL. What made you step into that spotlight? Did you actively want to become a KOL, or was it more you were approached?
That was nothing. That was never my intention to be a KOL or a speaker. It just happened naturally. I was first time I was approached by a brand which I was working with already, and probably I was one of the first few in the country to take on that device. And I was approached to do a small speaking event for them up north in 2022, I think, 2021 or 22. And it all started from there. And then I had more opportunities come up, and then just kept on rolling. So it's almost like a merry-go-round. You just get on it, and you can't you can't now come out.
Yeah, you can't get off. No, and I have seen you speak, and you really bring the audience in. And one of the things that I noticed when you were speaking is you're very honest and very real, which is something I think the aesthetic industry struggles to do, like be really open and honest and real. Because I think a lot of people that are going into the industry or want to pursue going into aesthetics, whether that's a non-medic or a medic, they have a perception of what it is. And you touched on it there, like doing a course and thinking you're going to be rich overnight. And I think you're very grounded. Is that something that has always been with you? Did that come from your sort of childhood? Like, where did that sort of grounded honestness come from?
It's always good to be transparent with everybody, whether it's your patients, your colleagues. There's no point in showing them this, fancy things and saying, people see me, we always put things only what we want to show people on social media. You can't sit there and cry.
Yeah.
And that's probably only 1% of my life they see. And what I want to show you, not what you don't see 99% of my life, right? And the more honest you are, the more people are going to trust you. And that's the only way you can actually show the truth. How else can you tell them what happens behind the scene? Like, I was at one of a speaking event where this was during the pandemic. That's when I started to do all my Instagram videos or TikTok videos, and there was a video that went crazy viral. I think 1 or 2 videos, and then I talk about this all the time on my talks. That doesn't mean I have like 1 million patients. Like if I've got 1 million views, that doesn't reflect to my bookings, right? I don't have 1 million patient on my list, or nor do I have 1 million pound in my bank account. So going viral or having that many views actually doesn't reflect your practice. If you have 50 or 100 people seeing your content, and out of that at least 10 of them are your local people, and out of that 10, 5 books in, that is what you get. No point in somebody sitting in China or India liking or sharing your post, or somebody sitting in Turkey liking your post. Doesn't make any sense. So even if it's 5, 10 or 15, if that converts, that is important. But people are always crazy about going viral and having views and excited about the views. But that is a lesson for me. I got a lesson from there that it doesn't matter how much ever views you get. That's not going to reflect into your bookings.
Absolutely. It's a vanity thing more than anything, isn't
Yeah.
it? Yeah, that's a really good point, actually. And I think something that we as Ignite really focus on is making sure that you're talking to the right patient, because that's the one that's going to come in and book, not someone
absolutely.
who just, it's interesting, they like it and they move on. Like, you want someone who invests in you.
And they don't, our patients, sometimes they don't even like or comment my post, but when they come in, they will say, oh, Nisha, what were you talking about, that neck treatment? Can I have that? But, you saw it, but you didn't react, but that's fine. And I know that's what they do. So
yeah, fair enough. And actually, you'd rather than pay for the treatment than just like your post. So win-win. So the aesthetic industry still carries a bit of a stigma from sort of the old Groupon days, is what I call it. Do you think that history and ongoing obsession with quick tactics and chasing leads and discounts and trends is going to be sort of pulled away and, focusing more on building trust?
Yes, absolutely. Because I don't think people I don't do discounts. That's my policy in my practice. I do add-on value things, like, if you're going on a package, we'll give you add-on, whatever we have at that time. You'll never find me doing a 10%, 20% discount, because to me, it's like my landlord doesn't take a discount. My finance company doesn't give me a discount for Christmas, and my staff, they don't take a discount for festive season. So why should I discount the money, which is probably I could buy something for my son, discount for my patients? It doesn't make sense.
That's a very good way of looking at it. Yeah.
And then why would you discount your service? What are you trying to tell your patients, that this is this cheap and I'm charging you extra? It doesn't make sense. Why is it cheap during Christmas and it's not cheap during the rest of the year? There is a value for everything. So you pay the value for what it is, whether it's Christmas, New Year, or Easter.
Yeah, absolutely. That's what I think. Discounting heavily can really devalue. It is about almost stacking.
Yeah.
Value stacking is more powerful.
And who's going to lose end of the day? Me, as a business owner. I'm losing, nobody else. Everybody gets their bills paid. The staff get their full pay,
Absolutely, I agree. So the average person probably still links aesthetics with beauty, I would say. Do you think that matters? And are aesthetics and beauty more like sisters rather than cousins? And like, how does that sort of impact, do you think, the perception of aesthetics?
I think it's totally different. When you talk about beauty, it's more about, manicure, pedicure, getting your hair done, or lashes, things like that, massage. Whereas aesthetics is more, it's medical. It's a medical treatment done in a medical facility, in a sterile place, for various things. So I think it's a bit unfair to say it's same as beauty. And patients need to understand this as well. I don't want to get into a debate of medics and non-medics, but UK is the only country that allows this to happen. It's not my opinion or your opinion. It is how the government has done it, right? So I've got many people I know who are non-medics who inject, and they always ask me, oh, what is your opinion? I said, it's not my opinion. Like, I tell them, like, do you think if I could go and do a weekend course on heating and plumbing, would you allow me to service your boiler?
Yeah.
No, you would.
Exactly.
You wouldn't. So there is a criteria for each person to go into each profession, right? So you wouldn't let me come and,
No, that's a really good analogy. No, I like that analogy. Yeah, I think that's a really good way of looking at it as well, because I think the beauty, like you said, beauty and aesthetics are very different, I think, but the public still for some reason see it as one. Not everyone. I think a lot of people are educated now, and they understand that actually the choice on where they go is probably down to them. And price wise, actually it's not that much different.
No, it's not.
But it's more the perception, I think, that maybe comes from non-medics still injecting and then also doing other treatments that are more beauty based, that kind of confuses the average person. I would say.
I don't blame the consumer, because they don't know. They don't know any different. They go to a place and somebody's offering nails, and in the back they're offering some other treatments, PRP or whatever it is, and only there are some people who would search to see if they're going to a nurse or a doctor when they want a treatment. So you can't blame them either. It's lack of information and lack of knowledge.
Yeah, and I think the interesting part is the price point, where I guess that's dictated by the manufacturers. Because if a non-medic is using a good product, they're probably charging very similar to a
Yes.
medic, because it's the cost of the product. So you really have to research the person and their background, and also I guess your priorities on what you care about as a consumer. For me, it was, I trained in beauty, actually. That was my background, but I would never ever touch a needle. I don't trust myself. I'm not putting a needle in my face or anyone else's face.
You always think like if somebody's holding a needle, you always link them to a medical professional, right? You wouldn't, you see all these people giving B12 jabs in the gym, like, hairdresser or a gym trainer or whoever. You don't associate that. And they don't even ask you like medical questionnaires or anything, what medications or what you're taking or when was your last blood test done. So
absolutely,
it can be a bit scary.
Yeah. And I think as a practitioner, whether you're a beauty-based practitioner or an aesthetic practitioner, it is down to, I guess, like you and what you feel comfortable. I used to feel nervous about doing microneedling. I was like, I don't even feel qualified to do that. So I guess it's down to the person as well and what they want to do.
I think everybody's different. I mostly think people are doing all these treatments, but they don't understand that what if something goes wrong?
Yeah.
Are they able to manage it? There are so many, treatments you see online, some of the non-medics. The work is beautiful. There's no doubt about it. But are they able to manage stuff? Are they using the right stuff? Those are things that the consumer needs to be aware of.
Yeah, I think that's the biggest thing for me. It's what if something goes wrong? You need to be in the right hands and make sure that they know exactly what to do in the event of something going wrong, which can happen whether you're a medic or non-medic. Like things go wrong.
Yeah, things go wrong. We do get complications all the time. That's what people don't see. We put up the before and after pictures, but every day you have something or other going wrong. Patients complaining of various things, which is a routine thing. It's not anything that
Yeah.
And the thing is that we can deal with it. And my patients trust me that if something goes wrong, they have faith in me that I can sort it for them, whatever it might be.
You're in a safe pair of hands. So trust is often described as like a real growth engine, I would say, in the private healthcare in particular. How do you design trust in your clinic experience?
Design trust. I think it's a combination of everything. From the time they find you on the digital platform, whether it's on your Instagram or website, it's almost like dating. I think, you find this person, you stop and you check them out everywhere, wherever you can, stalk them on Facebook or go on their website. And they already have a vague idea of who you are. So it's almost like a consultation through the content without a real consultation. And then they kind of match with you. They like you as a person, or they like how your appearance is, because sometimes you need to look at how the practitioner is looking. Somebody, whether it's the type of person you want to work with. And probably from there on already they know a little bit about you, how you are, how you present yourself. And they stalk you for as long as they want. And when they come in for the first consultation, that's almost like the first date. And the way you treat them, the amount of information and knowledge you share with them is what creates the first initial trust. We have a good conversion rate because of that. And I think that's where it starts. The journey starts from there. And then we take it on from there.
That's really interesting. Do you advertise, or is it all sort of word of mouth and organic?
It's a bit of both. We do have local advertising in the local magazines and the Google we do as well. And mostly word of mouth because we're in a small town. And school moms, they all know each other. My son used to go in the same school. So it's kind of people know. And I work in the local hospital, so people know me from there. Yeah,
nice. So do you believe a strong personal brand is now really important when running an aesthetic business?
It depends. So if it is somebody who is an investor and they're running a business, it doesn't really matter, But if you're on your own, if you're a practitioner coming into aesthetics and creating your business individually by yourself first and then taking on people, the brand matters because people are coming for you. Because they see your work, they know you, they connect with you, and they trust you. So every time somebody calls me for some treatment, they will ask me, are you going to do the treatment for me? So that shows that they want you as a practitioner to do the treatment. So yeah, it is good and bad.
I was going to say, how do you manage that? Do you feel pressure when someone asks a question like that, even if you know it might be passed on to another practitioner?
I do tell them, I mean, depends. There are some treatments which I don't do. So I tell them that it'll be done by my staff. Yeah. So they have to accept it because I can't, I do for one patient, but I can't do for everybody.
Yeah,
it's
absolutely.
not possible.
Yeah.
So there was a point when we started doing tier system costing. So if you wanted me, it'll be at this price, and then others. Then I just thought like it was getting a bit too much, and sometimes it still meant that I have to put in more time.
Yeah.
And then I thought it's not about the money. Like I can't dedicate that much time.
Yeah.
To do the treatment.
I mean, nice compliment if anyone's going to pay like extra for you. It's a nice little ego boost, but it still doesn't help the fact that they.
Doesn't.
But it shows that it's not about money, doesn't it?
No, it's not about money.
You know, reputation, care.
Yes. They trust you and they like you. The example, there was a time. I don't do as much social media as I used to do before, and in probably I think 2023, there was a time when I had a really like low phase, and I usually do like my Instagram stories almost every day when I'm going to work. I'm switching on the machines, blah blah blah, showing my staff and things like that. And it was a routine I was doing. And then I had this low phase and I stopped doing it. And the staff, the patients used to come in and they used to ask my staff, is Nisha all right? We haven't seen her. And that's when I realized how much they connect to you, right? And she was like, yeah, she's fine. It's all good. And then you see they look out for you in a different way. Yes. They see you every day. And then if you're missing, they're like, oh, where's she gone?
Yeah, they invest in you as much as you invest in them.
Yes,
absolutely. So with the new regulations being proposed, do you think it now matters more being a non-medic injecting? Obviously, we've talked about this a little bit, but is it the training or medical training that truly matters when it comes to patient safety?
I think it's a bit of medical training as well, because just having a regulation doesn't mean the patients are going to be 100% safe. I mean, patients are never going to be 100% safe because we are all humans. We make mistakes. Complications can happen. Probably if they are bringing in a specialist training that they have to follow, go through a certain course, like, level 7, which is the highest level of qualification they can get for aesthetic medicine, and have support as well in place, maybe things might be better.
Yeah, so it's kind of, we don't know what it's going to be yet.
We don't know, because it's not, I mean, there is always a debate about, we do the same weekend course as you guys do, so it's no different. No, we go through medical school for 4.5, 5 years, and our training covers everything, right, from head to toe and various other things. It's not just about injecting the face. So there is a difference in that, and there's a difference in understanding various factors that affect your body, not just about injecting toxin and fillers.
Yeah. No, that makes sense. I think that's the part that people don't consider.
Yeah.
Everything that happened before.
Yeah.
All the work that went in earlier. Absolutely. So what's something patients or peers don't see about running Niche Clinic?
Oh, God. As I said, it's only 1% of my life on my Instagram, and they don't see the behind the scenes at all. It's not easy. And I don't think any business is easy. It has its ups and downs. Especially when you start and when you're on your own, you have to do everything. Like whether it's your marketing, your accounting, your admin, you're injecting, your training, everything is on you. Whereas if you have some other business, you've got staff for everything. So you've got a manager, like you've got other businesses running at the moment. We've got 5 office staff who deals with it, and you really don't have to be there. Whereas this one, it's quite time consuming.
Yeah.
And especially post-pandemic, everybody expects you to be replying instantly. So whether it's on your WhatsApp for business or your Instagram, they kind of expect, and you feel obliged to reply because you think like, oh, they might think that I'm ignoring them, or I lose the customer if I don't reply. So you're almost constantly working.
Yeah.
There's no switch off time. There's no like cut off, like after 6, I'm off.
Yes. How do you manage that? Do you sort of self-regulate your time, or is it just you have to just answer if you need to answer?
Yeah, we answer if we need to, because sometimes sometimes it's just about reassuring them, right? We do get patients who had treatments probably 6-8 weeks ago, and they'll be like, "Oh, I've got this rash." Yeah, but it's not from my treatment.
You were 6 weeks ago.
You were gardening, and you had this rash. It's nothing to do with my laser treatment.
Wow.
So it's just about I don't mind spending that extra 3 seconds replying to them and telling them that, take a antihistamine. It's fine. It's not related to the laser. You'll be fine. And then after 2 days, they'll be sending a card and a bunch of flowers to say, "Oh, thank you so much for reassuring me." So it's okay. But then they don't understand that, that's not the only thing I do. I've got a life, I've got a family. And
true, yeah. I think people forget that you're human.
Yes.
You've got lots of space,
yes.
plates spinning, as they say. Absolutely. So how do you balance the demands of being the face with actually running the business?
It's very tiring. It's very stressful. It's difficult. It's difficult to fit in everything within your day, within the time that you have. But then if you are interested, if you're passionate about something, you will try and find ways to fit it in. And you have to go with the flow. Sometimes if you don't take up things that's coming your way, then, and if that is of interest to you and if you're passionate about it, you have to do it, hook or crook.
Yeah.
Yeah.
Yeah, you got to make it happen. So do you think being value-led and family-orientated changes the way that you show up as sort of a business owner and a leader?
Yes, absolutely. I'm very calm and composed all the time. And patients, they come with so many concerns, and whether it's after treatment. So it has a great impact of how you communicate with them. I've had, patients who have been very horrible to me, but then I replied to them in a very nice manner, and my staff are like, "Oh, why do you have to do that?" I said, "It's okay, it's fine, because they might be going through something you don't know. What the best I can do is be nice to them, right? What else can you do?" So the more, as we spoke before, the more transparent and honest you are, everything just falls in place and things will be smoother, even with the staff or with the patients or with the family. The more you stay calm and composed,
yeah,
things
absolutely.
will be fine. Because if I'm angry with something, me telling you something is going to make you angry. So why should two people be angry at the same time?
True.
I'll take it on me. I'll just be quiet. You be happy.
Yeah, no, absolutely. Do you think your NHS background probably played a part in that as well? Because you must have to be very sort of level-headed, and you're dealing with all sorts of people from all sorts of life. Do you think that kind of had an impact as well on your private clients?
I think so, yeah. I think overall, the whole journey, everything has had an impact on how to deal with people and how to navigate yourself through difficult situations. Even in the NHS, you can't take out while you're at work if you don't have enough resources, or patient gets angry, or something's not working. You can't take out your anger or aggression on anyone. You just have to, bear with it and deal with it. And that teaches you a lot, because you're working in a very stressful environment, and patients of different types, and that teaches you a lot how to remain calm.
Yeah, I imagine it really does. So when you built Niche Clinic, were you following the market, or were you just following what you wanted or what patients kind of were asking for?
It's always what I wanted. So everything I bring into my practice is something I want for myself. And that is, again, one of my ethos is that if this is something I would want for myself, I would want it for my patients. So same with the quality of the treatments, quality of the devices that I have is, I would go only for this device for myself if I went outside for a treatment. So I would want the same high quality for my patients. I won't compromise on that. And we are in a small town, and there are not many clinics that offer certain treatments or services that I have. And my intention has always been to bring things to Southend. Yeah. People come in and they're traveling to London, for a treatment. And from the beginning, I was like, I want things here so that they don't have to travel. And that's when I started to bring in things which, one, I wanted, because why not?
Absolutely.
So any treatment or service that I offer is something, and I try all the treatments, almost everything, which I can have on my skin of color. And yeah, so everything, and I think of course patients wants it as well. But then if there's a device I can't use, there's no point in me spending, 200,000 on a device
Yeah.
which I can't have a treatment on.
Yeah, I was going to say, what is the process of when you're investing in a device of that value? Like, is there a real sort of start, middle, and end for you?
I like shiny objects. So I stay away from all the conferences because I get dragged into this. And I don't think, I just take the risk, and I dive in and get the device even before knowing that how I'm going to pay for it. But it all happens. Everything goes smoothly because you have to have that mindset of things are going to work out, right? You're going to get the patients, you're going to pay it off. Money is going to come somehow. Yeah, if you are dedicated, if you're passionate and you do the right things in the right way, it's going to happen. And of course, we do a little bit of business planning, and accountants go through stuff and all that. Although I decide first, and then I tell them like, "Can you make this happen?" And yeah, and then we do advertise a lot before launching a device, and always we have a launch event for any device that we take on, and we call all our VIP patients, and we get a lot of bookings from that event itself. So before even we take on the device, like a week or two before it arrives, we do the launch event, and then we get a lot of bookings on that day, which kind of pays for the first few months until you're up and running with the device. So it's kind of a plan to get everything going.
That's great.
So you kind of cover the 3 months, 4 months of payments, and so that
I guess
works.
that's a testament to your client base as well, that they trust you when you bring in a new device. Obviously, if you have that trust already, then they're going to almost be waiting for you to bring in the next thing.
They always keep asking, what's next? They even ask my staff, what's Nisha planning next? I'm like, okay, hang on. I have only one kidney left now.
I love that. That's hilarious. So clinics often feel the pressure to look luxury online. What do you think authenticity is in reality? Is it about looking like the same as you do online, or is it more about the patient experience?
I think it's a patient experience. Yes, you have to look, good. The clinic has to look clean and neat and as good as it can be. But end of the day, no point in having a shiny clinic and you're not looked after very well. The patients always remember how you made them feel. Just like I said, it just takes 2 to 3 seconds to reply and reassure them. So if you don't follow them through the process and make them feel good, there's no point in having a luxury clinic where you're not treated well.
Absolutely, I agree. So talking about the treatments themselves, natural enhancements, obviously this is a phase that we hear quite a lot now. How do you define it in your clinic? What does that mean?
Natural enhancements, again, as you said, this is a word that people use now. It's more about how fresh you can look. Yeah, people come in and say like, I looked in the mirror and I just I've aged, overnight. It's not overnight. It happened over a period of time. But because we're all busy with our family, with our work, we neglect ourselves in a way, like especially women. And all of a sudden, like one day you'll be sitting there, either the kids have gone to university or, something's changed and you're looking at yourself in the mirror for another 5 minutes and like, oh my God, I've got these lines. I never had them before. Oh my God, I've got this. And that's when the wake up call, they're like, oh my God, I never noticed this, or I didn't see this. It wasn't there. It just happened like yesterday. So if you can do something to make them feel better, I think that would be more classed as a natural enhancement. Is not the right word, but make them look a bit fresh and not like tired and exhausted. That's what everybody wants. We don't want to look tired, although we might be tired, but we don't want to look tired. So doing that little treatments, whether it is injectables or laser treatments or energy-based devices, just to give them that extra boost to make them feel like, no, I feel good. That's what I think is natural enhancement.
And if you had to pick one treatment as your favorite, what would it be?
Laser.
Oh, okay.
Yeah, I love it.
Yeah. Do you feel like laser's got a place for most people, most things?
Yes. It's a beautiful treatment to have, and almost everybody can have it. Of course, dark skin, it's difficult, but if we manage it properly, it can be done. And that's one treatment I love. I have a couple of treatments a year. Yeah.
Oh, so you treat yourself to the laser treatments.
Yes.
Is that one that you will definitely try before bringing it in, or is it more a case of, because obviously, speaking of you being KOL, you're a KOL for Cyton, and Cyton lasers are,
Yes.
some of the best in the market. So do you try it first when they bring out a new device?
Yes, I did have my demo before any device. I always try it on myself. My staff gets to have a try on to see, because they need to be comfortable as well using it. There's no point in something I like and it's difficult to use or they can't do it. It's so we have a demo day where they get to try treatment. I get to have a treatment, and then we go from there.
I bet they love that.
Yeah, they love it. They love it.
They probably put their hand up, I'll go first. That's brilliant. So content is often described, as you pretty much said it, as the consultation before the consultation. How do you use education and storytelling to build trust before a patient comes in?
So I talk about, but I mean, I don't do as much as I used to do before. I talk a little bit about the treatment itself. Sometimes patients like it. What I've noticed is they don't really pay too much attention on my proper content, which I take time to do a video, or mostly it's the stories. They like me talking and doing, things like a very raw kind of a thing, which is what I get more engagement on. If I put a story about some treatment, then I get a lot of messages. But on the main grid, if I put something, there's not much interaction. They might be seeing it. So I try to do a mix of both, putting out content which might be useful for them to know, whether it's about skincare or acne and things like that, which is easily understandable, not too long. Nobody likes to listen to long videos. So I try to keep it really short as much as I can, maybe 30 seconds or so. So it's quick for them to go, not like, oh, it's boring. And keep it as easy for them to understand. So many practitioners, they use all the medical terms. Patients don't know what, if you say it's a DAO muscle, they don't know what a DAO muscle is. You don't have to use those terms. Even my staff say that I don't know what that is. Like a therapist, she'll be like, I don't know what that is. So no point in using complicated, medical jargons to talk to the patients. So keeping it simple, talking about treatments, talking about products, just helps them to get a bit more information.
Yeah, absolutely. And quite a big one, I would say, for practitioners who come from a medical background is talking about money.
Yes.
How do you cope with that? Are you comfortable talking about money when it gets to transaction, or did it take time to kind of get to that point?
It took a lot of time because I didn't have to, as I said, I have other businesses as well where I don't need to ask for money, or it's already like an invoiced, it's kind of known that this is what they're paying, and I still don't like asking for money, and I sometimes even like refuse kind of treatments, and then my staff will be like looking at me like, no, you need to ask. So it's difficult. It's still difficult for me to ask for money, but end of the day, this is my bread and butter. I need to if I could, I would do it for free, but I need to ask money, and I'm getting better at it.
Yeah, practice makes perfect. So in your clinic, do you treatment stack? So for example, if someone came in, would you offer them all the options based on treatment, or do you lead on budget? Like, do you ask about that when someone comes in for a consultation?
So when the patient comes in for a consultation, obviously the consultation is because they have a concern, they've identified something. And following that, I tell them these are the best treatment options for you to address your concerns, and this is what I recommend. And then they will be able to decide if they have the budget for that. So there's no point in doing a substandard treatment because the budget doesn't allow, because they're not going to get the results and they're not going to be happy. So that is one thing. But then obviously I appreciate everybody don't have the money to pay for big treatments. And then I would tell them, like, yes, if you can't do this now, or whether the downtime doesn't allow you to have this treatment, there are other treatments which you can have, but it won't deliver the same results as you want. You'll need multiple treatments. It'll take a longer period of time, but you might not get what you're expecting.
Right.
So they have the option to choose what they want. My advice is this, but if you can't afford it or don't have the downtime for it, this is the other route we can take, but don't expect the results to be the same, the outcome to be the same.
Yeah,
because I have to be honest. There's no point. I so many times I tell patients I can't do this certain treatment because they come in and tell me that I want this treatment. I said, no, that's not going to deliver you the results that you're looking for. and they go away. But after a few months, they come back and they say, yes, I want that.
Yeah, because it's essentially you're being honest, but also it's building trust, because you
Yeah.
could do it and then they'd be disappointed. What's the point?
Yeah. And there's no point in wasting their money. Everybody is earning money in a hard way. And if you don't give them the best value for the money they're spending, I don't think that's right.
Yeah.
End of the day, the money we earn is what we feed our family.
Yeah.
So you have to be honest with what you do.
Absolutely. And that's how you get a loyal client.
Yes, absolutely.
For sure. So you've spoken at global conferences. We talked about that a little bit, about, mindset and why it's a key part of aesthetics. Can you tell us a little bit about your experience speaking at conferences and how you decide what to focus on?
Yeah, it is very daunting. So my first international speaking was in Bangkok in 2023. And I was super nervous. You get on the stage and you have this big stage, like with a double big screen and this huge hall. People don't see that you're like breaking inside and you have to keep this face as if you're really super confident. And it teaches you a lot. Again, every journey is a learning curve, isn't it? And talking about mindset, like even today, you have to, your emotions actually decide how your day is going to be. Yeah. So the quality, when you wake up, the way you think is what drives your day or your life itself. What I speak at conference, it depends on what the organizing committee wants. So either sometimes there'll be a topic on how to run a successful clinic, or it might be something to do with laser treatments for skin of color, or it could be anything. So the next one I've got in Bangkok is the doctor as a marketeer.
Oh wow. Nice.
Something like that. Yeah.
Amazing.
So it's almost like what we discussed about the content that as a practitioner you put out, or your consultation. So that is also marketing, isn't it? They sit in for a consultation. The way you present yourself is a bit of marketing.
Absolutely. Yeah, no, exactly. And I think it's really interesting to hear it from a point of view of a practitioner versus a marketer telling a practitioner how to do it, because I guess you're living it and you know what each step takes to get to them turning into a client.
Yeah, it's so different now than it used to be, because before we never had to switch this section on to think that I have to do all of this in a certain way. It was almost like automatic. You didn't think too much. But now it's like almost you have to plan it fully. And I wish we didn't have to like sit and make these videos and dance on TikTok to, for the patients. I would just love to be with my patients injecting, not like spend half my time doing all this marketing and stuff.
Yeah, a lot of people say that. Like that's almost like a full-time job within a full-time job.
Yeah.
So many practitioners, even experienced ones, struggle with imposter syndrome. How do you move past that? Do you get imposter?
Still every day.
Really?
Every day. I don't think I'll ever move past that, because you always feel like you're never enough. You're not doing enough, or you're not worthy of things that comes your way. But then you forget that because of your hard work, you are getting these opportunities. So you have to appreciate that as well, and give yourself some credit and move with it and accept what's coming your way.
Absolutely. Yeah. It surprises me that you have it, because I feel like your credentials are so long and so vast, but I guess everyone has it in their own way.
Everyone has it. And I don't think you'll ever, I don't think I'll ever think that, I go in a room, I feel like, oh my God, am I even meant to be here?
Wow. Yeah. Well, you are. So patients often take months or even years. You talked about they could be doom scrolling on your page for hours. How do you stay in front of mind for these patients? Is it social media? It's
mainly social media. We do email newsletters, updating my Google business profile, mini events in the clinic. That's helpful as well. Stories. Yeah, they love stories. So doing that. If you don't keep up, they'll forget, Yeah, I mean, you would know better, like, whatever you put on your socials, nobody's going to, if you come on my profile, you might check my first 3 or 4 posts. You're not going to go back to 2022 and see what I did. Oh, I hope you don't, because they're all cringe those days. They're dancing and doing all those pointy reels. They used to call me the pointy reel doctor.
I remember the pointy reels. Yeah, I remember those.
So, yeah, so you have to do things to, to be in their mind all
Yeah.
the time. So I think stories and trying to engage, and even in the clinic when they come in for other treatments with other staff member, I would pop out and say, like, how is your treatment going, so they see you and they know that you're still there.
Yeah, someone said something, I'm probably going to get it wrong, but when you come into clinic, you should rotate the posters or sort of leave behinds in clinic every so many months, because it kind of sparks people to try something new.
Yeah.
Do you try things like that, like more in-person sort of marketing, or is it very much online?
No, we do. Like when they come in, we work on a more personalized manner for the patients, because not everybody wants or likes all the treatments. So there might be people who are not keen on injectables. So I don't offer them any injectable treatments. So their marketing would be different. And if I have makeup package, then I would send to people I know would want it.
Right.
Or when they come into the clinic, I will say, look, this is what you had last year, and I'm going to make this another one for you. Do you need anything else added on? Have you thought about something else? Maybe they saw something or their friend said something they want to try, and then I would integrate that into their plan. So it's always customized. It's never one size fits all.
Absolutely. So I feel like we've talked about so much, so much. And we've got to the point, my favourite question that I have to ask everyone. So obviously you've been NHS, you've been private practice, and I'm sure you've come across your fair share of patients. So what's your most outrageous, unexpected moment, whether it's in clinic, in NHS, that involved a patient?
I've got quite a few. I don't have time for that. So we treat a lot of male patients in our practice, and especially the hair removal. And it's more and more getting more popular now. And we had this gentleman who he drove from quite far away every time he comes from, I don't know, 3 hours. I don't know why. And he had a few sessions of laser hair removal, and then he messages me one day like, oh, I've got this patchy hair on my body. I'm not sure why it is. I think he finished not finished, but probably 4 or 5 sessions, and he had the full body, like full body.
Wow.
Even in his earlobes and everywhere. So
Wow.
and I said, okay, come in for a review and we can have a chat. He said, oh, I drive 3 hours to get to you, so I can't drive, so I'll send you some pictures. I said, yeah, sure, send me some pictures. And then so it was a video. It was like probably 3 minutes of video, and the video starts and he was like, oh, this is on my neck, this one. And then he's in his bathroom and it goes all the way down, and I was like, oh my god, I don't want to see this. And I was like, oh, and I was like, oh god, like yeah. So that's something I can't forget.
Oh no. I bet you deleted that straight off your
I
phone.
did. I didn't want anyone to see me looking at some man's.
That's brilliant. Oh my god.
Yeah.
Do you know what? I keep hearing this, like, I mean, yeah, I'm slightly speechless at how many people send videos like that.
I know.
To practitioners.
I mean, I don't do the laser hair removal, so I don't see them naked. And obviously the staff would have. So maybe he thought it's fine to send a video, but no.
Oh no. Oh gosh. Well, yeah. I mean, that is a good one.
Yeah.
Amazing. So you've been so great. You've been really open, and I've loved chatting to you, and it's really been insightful. And I love your approach to content. Obviously, being an agency that works in marketing, content is a big part of what we do. So yeah, obviously people want to come and follow you and find out more about you. Can you tell us where they can find you, how they can, start stalking you?
So my practice is based in Southend-on-Sea, Essex, and my clinic is called Nish Clinic. So you can follow my Instagram account, nish.clinic, and my professional account, Dr Nisha Menon, on Instagram, Facebook, and LinkedIn. So thanks for having me today.
Yes.
And I really enjoyed talking to you.
Brilliant. Well, I have one more question for you.
Sure.
The question we have to ask: is the patient always right?
No.
I'll let you expand.
No, because they're coming to us for a reason. Yeah, we are the experts in whatever concern they have, whether we are treating them in the hospital, whether we're treating them privately. So you have a better knowledge of the concerns they have and how to treat them and manage them. Just Googling or looking up on TikTok or Instagram is not enough, or ChatGPT now is not going to give you the appropriate care and management that you need. It might give you some advice, but that might not be for you because it's giving you a blanket advice. Yeah. So your skin is different. My skin is different. I always tell the patients that the results that you might get to what I get is totally going to be different. You can't expect the same results for two people. We are unique in each our own way. So patients are not right. We are different. Yeah.
I love that. Great answer. Great answer. Well, thank you so much for coming on. It honestly was a pleasure. And yeah, hopefully we'll have you back again one day.
Thank you. It was nice speaking to you.
Love hearing the real stories behind the aesthetics, medical and dental industries? Make sure you follow us on Instagram and TikTok at The Patient Is Always Right for exclusive content. You can listen on Spotify, Apple Podcasts, or wherever you get your podcasts. And don't forget to watch the full episodes on YouTube. Hit follow, subscribe, and stay tuned.